Hi, Dr. Jeffrey Mark here. Today I'd like to share with you some interesting news about kids and teenagers and COVID-19. A lot of attention has been paid to those over age 65, and in my last video update and news blogs, I've shared how younger adults in the late 30s to mid 50s have been showing up in emergency rooms with blood clots and some with strokes and being COVID-19 positive. There is an unusual inflammatory syndrome in kids and teens linked with COVID-19. I have evaluated children with abdominal pain and have had parents ask about their children's abdominal pain, fever or nausea and vomiting now and in the past, but there are now additional considerations in light of recent reports. 73 children in New York State as of May 10th have had an initial presentation of a persistent high fever over several days and significant abdominal pains with repeated vomiting. And the child doesn't feel any better or different after the vomiting, which is not typical. The new condition has been called Pediatric Multisystem Inflammatory Syndrome. Symptoms progress from the persistent fever to extreme inflammation with the involvement of one or more organs that are compromised. So far, these symptoms resemble a rare disease called Kawasaki disease, or KD, or Kawasaki's disease shock syndrome, KDSS. Kawasaki disease, or KD, is an acute illness in children involving fever with symptoms including rash, conjunctivitis, redness in the lips, tongue, and mucous membranes of the mouth and throat, swollen hands and or feet, and sometimes an enlarged group of lymph nodes on one side of the neck. Some children with the condition develop enlargement of the coronary arteries and aneurysms in those blood vessels. A small number of Kawasaki cases progress to symptoms of shock, where the blood pressure can go so low that there is not enough blood flow to supply oxygen and remove waste from the body's vital organs. Both KD and KDSS mostly affect young children, but have been seen in teenagers. The new syndrome has some of the features of KD or KDSS, such as the rash, conjunctivitis, and swollen hands or feet. Like the KD and KDSS, it affects young children and also teenagers. What is different in the new inflammatory COVID-19 syndrome is that there seems to be a lot more cardiac inflammation, which is usually very rare in KD or KDSS. More of these cardiac inflammation cases have been seen in New York City and London, which incidentally have very large numbers of COVID-19 cases. Other patients exhibit symptoms more similar to toxic shock syndrome, with abdominal pain, vomiting and diarrhea, and high levels of inflammation in the body, including the heart. Most cases are treated in the intensive care unit. Treatment involves intravenous immunoglobulin, which can calm the immune system, as well as steroids and cytokine blockers. The evidence so far from Europe, where reports of the syndrome first emerged, suggests most children will recover with proper supportive care. Most children with the syndrome have either tested positive for a current infection with the coronavirus or for antibodies to the virus, in which case they may have been infected earlier and recovered. According to case reports, some of the kids with inflammatory syndrome who tested negative on coronavirus tests had been exposed at some point to someone known to have COVID-19. The inflammatory syndrome can appear days to weeks after COVID-19 illness, which suggests the syndrome arises out of the immune system's response to the virus. One theory is that as one begins to make antibodies to SARS-CoV-2, with the antibody itself provoking an immune response. This seems to be happening in susceptible individuals whose immune systems are genetically or environmentally altered. This can be from past infections, vaccines, or other allergies, and they react in a particular way. It doesn't happen in every child. It's still a really uncommon event. Therefore, if your child or child you know has a persistent high fever over several days and significant abdominal pains with repeated vomiting, and the child doesn't feel any better or different after the vomiting, you should at least call your pediatrician right away and get evaluated. In continuing our series on brain fog, I'd like to share with you a short introductory video on the mitochondria and a product called Mitomax. You can watch it here, and we will be discussing more about the mitochondria and other topics next week. Hi, Dr. Jeffrey Mark here. Think back to your high school biology class. You learned about the mighty mitochondria, the powerhouse of the cell that generates all your energy needs, but also produces harmful free radicals. When your mitochondria can't keep up with energy demands, your hardest working organs, like your brain, heart, and immune system, slow down. If you have low energy, mental fog, and always feel fatigued, it's time for a boost with Mitomax. Mitomax is scientifically formulated to provide clean protein and recharge cellular energy production with a triad of targeted nutrients. Acetyl L-carnitine shuttles fuel into the mitochondria, where it's quickly converted into energy. Powerful antioxidants alpha-lipoic acid and N-acetylcysteine catch and neutralize free radicals. This ensures the cycle of energy production continues, maximizing your energy. Try Mitomax for your body. If you'd like to take advantage of the time you have sheltered at home to do the GI Reset program, please call our office to schedule a telephone or telemedicine video chat consultation. For more information on food intolerances, mitochondria, exercise to benefit respiratory and immune functions, sleep, supplements, foods, and stress reduction to help boost the immune system, please see the blogs on www.allfunctionalhealth.com/blog. If you have comments, questions, or want to learn how functional medicine can help with improving your brain and immune function, call the office or email info@jeffreymarkmd.com. Stay healthy and take care. We now offer online functional medicine assessment, HIPAA-compliant video or phone telehealth visits, and in-home functional lab kits that you can mail back directly to the laboratories. We can work together to address your health challenges in the comfort and safety of your home during COVID-19 shelter in place and beyond.